I went to the University of the South in Sewanee, and then later to the University of Tennessee Veterinary School. After that, he went to West Africa and spent time taking care of oxen. So if you have oxen, this is the guy. And goats and donkeys and all of those kind of things. Then he spent a lot of time in community service, including time in Britain and Her Majesty's service dealing with foot and mouth disease. Now wait, that's not foot in mouth disease. That would be.
I suffer from that.
Yeah, he did that. He really helped me with that. So anyway, he's done that. And of course, working on Newcastle disease in California, U.S. Department of Agriculture. So much community service. But what's really exciting is the time he has spent in disaster relief for animals. He spent 6 weeks with Katrina. He spent 2 weeks with Sandy up in New York, operating a mobile clinic there. That was Thanksgiving time 2012, as you'll recall, so we spent 2 weeks through his Thanksgiving holidays. He's been very much involved. He's currently the deputy commander of the Hamilton Disaster Animal Rescue Response Team, DART. So he's been doing that. John operates the Animal Care Center up in Ooltewah, which is just up past Ooltewah High School, 238-9005. You get it by telephone, or at 9124 Amos Road. If you know where Amos is, right up there. So John is our incoming president of this organization. We'll be replacing Joshua this summer, so we'll be seeing a lot of him. But today, we want you to welcome him with a good puppy. Welcome and give him a ooh. You remember the look you do when you see a little puppy? Ooh, give him one of those. But let's welcome our own Dr. John Mullins.
Thank you for that nice introduction. Really. I had a note. There's going to be 2 parts to this. One part is going to be talking about the disaster response to Sandy. The other is going to be some pointers that I have learned. And this is not working, I'm sorry. I don't know what I do. It's going to be some pointers based on my experiences and based on recommendations of the ADMA as regards to ways to keep your pet safe in a disaster.
Good, thanks. And I hope you get something out of it. And I'm hoping this works. It does. So, the INVERT, or National Veterinary Response Team, of which I am a member, there are 5 teams. They are, and it has no rhyme or reason as regards to where the people come from that are members of each individual team. There are people on my team from Alaska to Florida and California. So it just depends on when you joined as to what team you might belong to. There are 5 teams. We are part of Health and Human Services under the National Disaster Medical System. We are part of Emergency Special Function 8, which is a group of medical resources that are available to the government, and they are called up as needed. We cannot self-deploy. We are intermittent federal employees or special federal employees. We have to be requested. And typically we are requested when local resources are overwhelmed, as happened in Sandy. That goes back to the United States Constitution. There's the posse comitatus, which is a Latin phrase, and federal resources cannot enter private property or state property without being requested. And that's to protect your rights as a United States citizen. Other countries, you might know, They have their soldiers. There's not a lot of difference between their soldiers and their police. In the United States, there's a very clear division between what is Army and what is local police, and that's to protect our rights. We rotate who's on call per month. A team is typically on call for 1 month, and then the next team comes on the next month. And we can be deployed as squads or the whole team. And on one occasion during Hurricane Katrina, all the teams were called up. Part of our mandate is that we have to have all our gear ready to go constantly. After deployment, we have to be on site in 12 hours. We have to be operational in 2, and we are self-sustaining for 72 hours with water, food, and equipment. We have in a hospital that can be deployed. We have our own tents that can be deployed to stay in. And happily, quite often we are able to be billeted in hotels, which is much nicer than a tent. Part of our mandate is we have to be physically fit. Shout out to Fit One Gym. Appreciate y'all. The last training that we went to was with the Indiana National Guard Decontamination Unit. This was a special occasion. They were trying to figure out how we would fit in with the decontamination unit, because typically they're decontaminating people and they have no idea what to do with animals. As part of that, there was a voluntary fitness test at 5:30 in the morning, and we had a choice of, you could go 1 mile carrying 10 pounds and you had 15 minutes to do it in. You could do 20 pounds and you had 30 minutes to finish it. You could carry 45 pounds and you had 45 minutes to do it in. And they got about 95% participation, and everybody finished and accomplished what they were supposed to do. The head of the National Disaster Medical Service was there, and he was laughing after. He said, "We have tried to get the doctors and the nurses to do this, the real doctors and real nurses, and they won't do it. They all refuse. And here we got 95% participation from you guys," which I think that says a lot about what kind of people we are. It's a very, very unique group, ranging age, men, women, black, white, Asians, from 20 to 70s. And everybody just gets along so well together. We don't see each other typically, for months at a time, but every time we get together, it's like you haven't passed any time at all. Although we do have monthly conference calls that we have to speak to each other. We are able to do veterinary assessments on site. We would work in a sheltering environment. We can take care of up to 100 cases a day. We are supposed to take care of large and small animals. That's horses and cattle and dogs. We can take care of service animals, which would be search and rescue. And some of my team was deployed for 9/11. Then we can work in hot environments and very nasty, dirty conditions with debris-filled environments, and all of that is part of our training. We can even do laboratory animals, which are rats and mice. We have our own command system with a team commander, a logistics officer, an accounting officer, operations officer, and planning officer. So all of those can be deployed and come into play if necessary. If we're too far away from the IRCT, which is the Incident Response Coordination Team. And there may be other requirements that would have to activate that in case there's what's referred to as span of control, so that everybody's coordinated, everyone knows what they do. If it gets too broad and you have too many people under you, then they split it and you get another person in charge of that group. Some of us have been deployed to Haiti during the earthquake there. Originally we were not supposed to leave the continental United States, but now that mission also is changing. So with that background, on September 29th, Sandy made landfall, and Sandy hit in probably what is the most densely populated area of the United States. I mean, you could have taken aim and hit it, and it hit it pretty much dead center. The New York City New York City has its own veterinary emergency response team, and this is pretty much what they were confronted with. And they determined their resources were overwhelmed, which is how the system works. So when they determined their resources were overwhelmed, they applied for aid from the federal government, and the first team was sent. The first team went in, and we had our first conference call on November 7th. There were 2 team members there that were directly affected by this event, Dr. Jeff Strom and Dr. Robin Brennan. And Jeff has a clinic on Long Island, and Robin was working in a clinic in New York City itself. Robin said, I had 3 feet of water in the hospital. I cannot access the records. I can't get in the building due to electronic lock. You think your building's secure because you have all of this great technology at your disposal. Well, when the electricity goes out, the lock is locked and you can't unlock it. So you need to think about that if you're ever planning for a disaster. She said, I'm so burned out, I don't know what day it is. And Jeff said, well, it never ends. We had a foot of water at home. There's no electricity and there's no heat. I'm running out of wood. We're trying to keep everything together. At the hospital, there's no electricity. We have a full hospital. We're using light for the windows to do treatments. We stay bundled up to stay warm. We have animals dropped off by owners who are displaced. We have to wait hours in line for gas when there is gas. And I have clients with sick animals, but there's no gas for their cars, or the cars don't run because they were flooded out. And his statement was, I feel bad, I'm not helping anywhere else, but I can't. And I'm thinking, sounds like you're doing pretty good. Yeah. And then we had 2 teammates, Michelle Beckman and Christine Tolliver, and they were deployed as well in the first group, and they were just saying, it is so cold here, we're cold all the time, and there's this biting wind off the ocean, because most of these areas were, right at the ocean level. So they asked us to go in the second group, and, there's Patrick, he was our team leader. He's from North Carolina. I'm from Tennessee. Marie is from Missouri. He was from Colorado, Virginia, Florida, Massachusetts, in Alaska. So you see, we came from all over. They ask, you don't actually, if they request you to go, you don't actually have to go. You can say no. But, after listening to them talk about their experiences, how was I going to tell them, no, I can't go? I'd only been open for 2 years at that point, not even. And, but when you hear them talk about what happened, how are you going to tell these people, no, I can't do that? Really? So our assignment was to decontaminate, do shelter care, which was in Brooklyn here. And then there were the Rockaways and Coney Island, which were 2 communities pretty severely affected. And I got really lucky because we didn't wound up not doing too much decontamination. These slides are from Katrina. These are mainly slides from Katrina because I don't really have any from the event in Sandy. You cannot imagine how nasty that water is. It's contaminated with fill in the blank. It's got heavy metals. It's got sewage. It's got anything else that's in the mud that's off the coast. The air was so polluted that when I bent over to write something down, my nose would it was like I had turned on a faucet. I mean, it would run continually, and everybody was doing that, and they called it the Sandy Sniffles. It was worse than when I was in Africa, when in the dry season, the harmattan would come down off the Sahara, and the air it was hard to breathe due to the dust in the air. And the sky would be brown. And at the grade schools, at the international school, where the kids were drawing pictures, they would color the sky brown because you didn't see a blue sky. So it was worse than that, and the smell was pretty bad too. So the shelter they set up here, this is the cleanest this place ever was, although they kept it really hygienic and really spotlessly clean. It's the quietest it ever was too. They had a bunch of animals here. The cacophony was really wonderful. They had sick animals. They had animals having babies. They were boarding animals, displaced people, that didn't have a place to go. And the bulk of the team wound up going there. But I got lucky because I got with Lori, and she and I were assigned to the Poochmobile. And I really am grateful that I got to stay here because I couldn't have been in that building. And this was where we found our first assignment. This was the first place that they sent us to, which was the Rockaways. And this is pretty much what we found. This section of houses, they were flooded. And then there was an electrical fire, and because they couldn't send anybody to put the fires out, it just went from house to house right in for blocks. And the people were home. So what are you going to do? You're stuck here in this house, and you can't get out. And this is a good point to say at this point, or a good point to make right now, which is if they tell you you need to evacuate, you better evacuate. Because if you don't, they don't lightly tell people to do things like this. And sometimes you shelter in place, and sometimes you evacuate. But if you're ever told you need to evacuate, you need to go. This was the first person that I saw there when we parked we're checking out the area. And you'll see this young lady later. She was sitting there. This is her boyfriend. I don't remember their names now. And they were waiting for the insurance person to come, and they had to make some sort of report. There's all these problems with insurances because what damaged the house? Was it the water? Was it the wind? Was it the fire? It's pretty evident it was the fire. But people might or might not get their payments based on what the insurance reports are. And this particular day, the insurance guy never showed up. But, that's probably not his fault because there was thousands of houses that were affected by this. Another thing that we saw when we were driving out there was they had to clear the roads by pushing the cars out of the way because the cars were all flooded out. And they would be parked there and they couldn't move. You couldn't start them. You couldn't drive them. I don't have a picture of that, but it was all the way down the highway. There would be cars where they were destroyed. And imagine this is your business. All of us are in business here. This was a restaurant, Lupe's, and you've got a great place. But imagine this was Lupe's, and this is what you found after it flooded. More of the same. This mountain, that's sand that the ocean brought in, and they had to clear the roads by pushing this out of the way, and they had to take it somewhere. So this is a public park, about 4 acres. So that mound covers about 4 acres, and it's about 70 feet tall. I really wasn't supposed to take a picture of that, but sometimes I don't follow directions. But I thought, I want a picture of that. And they were in pretty much a bad way. So where we were sent was St. Francis, which was coordinating the response effort in the Rockaways. And at St. Francis, the water level came up to here. How, you ask? Do I know that? Because inside that building, here is the water level, right there. That's where the water came to. Imagine your house is right down the street from that, and it's not even elevated that much. Every one of those houses, even if they didn't burn down, they got flooded. Every one of them had flood damage. And, this church looks pretty much undamaged, but everyone had damage. And this is the Monsignor. This is Lori, one of the world's greatest vet techs. She and I had a great time. And I know I look really fat there. I'm not. That's everything I took with me. It was so cold, you guys wouldn't believe it. I was freezing to death every day. This guy is Mr. Gubernati. Yeah, Oscar Gubernati. He was coordinating the effort there. He was totally voluntary. Most of the people that we saw working there, they were really good at helping one another. I was really impressed with them. And people would come and sign up, and they had a volunteer sign up there. And then a lot of people didn't have, their cell phones weren't working. They had a place where you could bring your cell phone and charge up at the shelter. It was called a warming center. That's how cold it was. You went there to get warm because you were in your house maybe, but there's no water and there's no heat and you have no electricity. But you didn't want looters to come because those guys would show up. And they would stay there in their houses because they were afraid of looters. There's my office. Veterinarians are really good at making do with whatever we find, because most of the time we're making our own instruments. Back in the old days, sometimes we were even making our own medications. We don't have to do that anymore because things have improved. But when I started, a lot of times you would have to adapt and innovate, and that's something that's just second nature for us. A lot of you would probably have trouble with it, but we just adjust. We were distributing, or the center was distributing dog food. We didn't handle that so much, but they would do it in conjunction with what we were doing out of the clinic. And then this is Molly. He would come by every day and bring Molly. A couple of times Molly was dressed up, but it was kind of cute. This guy's a retired firefighter, but he was just, the people there were just wonderful. This is Ms. Nagel. Ms. Nagel was there with, that's Lori again. She was helping, and that's Roxy. Roxy had an eye ulcer. Everything was either respiratory, skin, or eye. And it was because of the dirty conditions and all the filth that came in. And if they got trapped in that water, and you didn't wash them off, they were going to get skin disease. If we didn't wash ourselves off, we would get skin disease. This lady, she brought her pooch. And this one I know was an eye thing because we put a cone on it. That has to be an eye ulcer. This fella, and these people, a lot of places, they were already in bad shape. This gentleman had lost his job, had been looking for a job for a year. He didn't have anybody like AIM to help him out. But, he brought his dog by because he was going to have to surrender it. And he wanted to make sure it was in good shape before he gave it up. This lady came by. I think she was a nurse. She was really a sweet lady. This lady came by and she was Russian. There was a large Russian community there. I could understand about half what she said. But we wound up taking care of what her problem was, and she was happy. And this lady came by with her child and their cat again. And, there were some really, really nice people that came by. I was real impressed by this gentleman. He and his wife brought their kids out because we want to teach our children that when there is trouble, you need to help people. And so they were bringing them out because they wanted to show them that this is what people do when there's trouble and they can help other people. So I was really impressed by this guy. This fella had a restaurant. They would come in, and these people, they can't take showers, they can't take baths. That's his girlfriend and his dog Renzo. And I didn't know he was a chef at a 5-star restaurant, and the restaurant got destroyed, but you couldn't tell who's who. Another family that came by. This is the young lady that I told you would see later. That's her mom, her dad, her boyfriend's mom, and then their dog. And then I found out in talking to them, this is our last day there. They were in the house when it flooded and caught on fire. And so they had to get out of the house, and she had called her boyfriend to tell him, the house is on fire and we can't stay in it anymore. And he was wanting to go to her, but of course his mom, being intelligent, wouldn't let him out because the water is about 8 feet deep and there's cars rolling down the street in the water. And so her dad and she had to get out of the house. Well, the water got them and was carrying them out to the ocean, and their neighbor was able to throw a rope out and pull them in so they didn't drown. And then what I found out was that if she slept with the dog, then she didn't have nightmares. So, even though I gave up a couple of weeks to go up there and do that, and it was not a good time to be gone for my business, but, learning things like that makes it worthwhile to do stuff like that. And all of you all, I know several of you in here have done disaster response. When we had the problem with the tornadoes, a lot of y'all responded to that. And when people do things like that and help each other out, it really, I think, builds a stronger community. I saw evidence of that at the Rockaways, where they helped each other. And they really had a strong community there. And I think they're going to come out of it and they're going to do fine, even though that's probably the worst single event that ever happened there. They're going to do well after that. We need to put, yep. Okay. And I do have the pointers for your pet and disaster response. I didn't know if I was going to be able to finish, so I've printed it out for everybody. It's the same as would be presented here. So if you would like, Amanda can give you some. So that's all I have.